Okay. Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. Today we are in Brooks, Georgia at a retreat, and we are pleased to have Miss Jennifer Shinpo with us. Jennifer is from Watkinsville, Georgia, and Jennifer first came to see us a little bit over a year ago. Jennifer, what did you come to the Goldberg Clinic with? What kind of problems were you having at that time?
I was experiencing thyroid issues.
Thyroid issues. And tell us a little bit about the history of your thyroid issues, because as most of our listeners know and our patients know, I'm very concerned about women with thyroid issues. I think that way too many of them are being prescribed Synthroid and other thyroid stimulating drugs. What was your situation?
So after I gave birth to my first daughter, I started experiencing extreme fatigue, extreme irritability. I couldn't sleep at night. I didn't know what was going on with my body. And then I tried to have a second baby, and I had 2 miscarriages. And then went to see an endocrinologist, and she put me on Synthroid, saying that my antibody levels were raised.
And she wanted to put you on Synthroid, which is synthetic thyroid, because your antibody levels were high. Did she have any idea, or did she talk to you about why she thought your antibody levels were elevated?
No, I just received a phone call saying that they were elevated and I needed to go on this medication, and I may or may not be able to have another baby without a medical procedure being performed.
So as with literally millions of women in this country, Jennifer went to a medical physician. Her thyroid levels were off a little bit. Sometimes it's because TSH is elevated. Sometimes it's because T4 is low. In Jennifer's case, it's because her antibody levels were high. And really, without any look at why this was happening, she was put on thyroid medication. In your case, it was Synthroid, right?
It was.
Which stands for basically synthetic thyroxine. Shortly after that, you came to us, and we started to work with you. We individualized a program for you after doing an exam, a consultation, and some lab work. And today, we're seeing you for a re-exam. And tell us what's the outcome of your general health and specifically your thyroid health.
I am currently off of Synthroid completely. I've been off of it since November 2015. It is now July 2016, and I've felt the best I have in my whole life. 99.9% better. And
that's what she wrote down here. On a percentage basis, her health has improved, she says, since coming to us, 99.9%. We're very concerned that there's 0.1% of 1% we haven't improved yet. We'll work on it.
I have 4 children, and that point of a percent is because I have 4 children that I keep up with daily. But overall, my life is just has been completely given back to me. I know what it means to eat healthy now and to make good decisions concerning stress, and just I've been given the keys to having a lifelong journey of being Synthroid free.
You know, and I love to hear that, because she says she's been given the keys, and that's what we're trying to do. We're trying to get people well and give them the right information for them, for their particular case, so that they don't have to keep being reliant on any doctors, including Dr. Tenner and myself, because we believe strongly that real health care is self-care. So we're going to be seeing Jennifer. We haven't seen her on a particularly frequent basis even since we first saw her, but we're going to be seeing her less and less and less now. So she can really say that she's become basically her own doctor. Jennifer, thank you so much for giving us that very, very good news. And we're just delighted that you're off all of your thyroid medications and that your health has improved only 99.9%. Thank you, Jennifer.
Thank you.
We really are concerned. I have been concerned for many, many, many years about the frequency with which women are put on Synthroid and other thyroid medications. The thyroid gland plays such an important role in the body and is connected to our overall health. It's connected to our adrenal glands, it's connected to our pituitary, it's connected to everything. And when women or men are put on thyroid medication, what they almost are never told, and they should always be told this, is that once they start taking it, it causes their own thyroid gland to start to degenerate, because it's a type of replacement therapy, which means that over time, The thyroid gland, which may have been pretty healthy to start with, now becomes less and less and less potent to the point at which it loses its vitality, and that woman or that man now has to be on thyroid medication throughout the rest of their life, and in almost all cases, they really don't feel that much better. After a while, the vitality still drains out of the body, and they really have not addressed the causes of why their thyroid hasn't been working well. We find that in most cases, we get to a person early enough, we can get them off thyroid medication, and they can be healthy and have normal function. And why does that thyroid get run down in the first place? Not enough sleep, bad diet, too much stress, toxic exposures. Those are the things that need to be identified. And once we can identify the causes, once we can address those causes, then health can be restored and the person can look forward not to a life being on ongoing drug medication, but to a life where they can really have good vitality, good health, without having to be reliant on any type of pharmaceuticals.